So once again, we are very, very grateful for Dr. Bliss for presenting the webinar today. Dr. Andrea Bliss is the psychologist for the MAPS OCD clinic at the Alberta Children's Hospital and the founder and owner of the Child Forward Centre. She specialises in the assessment and treatment of anxiety, obsessive compulsive disorder and related disorders in children and youth. She's a clinical associate in the Department of Psychology at the University of Calgary and provides workshops, training and supervision for students and other professionals on the assessment and treatment of OCD within the family context. I hand it to you, Dr. Bliss.
Thank you, Julian. Good morning, everyone. Thanks for joining us on this snowy December morning. I'm going to be talking over a cold this morning, so I will enunciate as well as I can. I'm excited to be here this morning to talk about how we can include school in OCD treatment for children and adolescents. Some of it will be similar to the webinar in November around including family, but of course there are some unique things to know about working with schools. So the scope of this presentation is really directed to therapists who are working with children and teens. That's the lens I'm going to be taking. I know there's also going to be a webinar for teachers specifically to talk about what they might notice in the classroom and what they might be doing. And so I hope that these two webinars really complement each other. Let's see here, there we go. So just quickly, why would we even have a whole webinar on including school teams in this treatment? Well, we know that when we're working with kids and teens, they are spending a lot of their time in the school setting. We also know that, I believe one study showed that almost 50% of children with OCD and their parents, they've reported significant school difficulties. So I'll give a number of examples about how their academics and their social functioning are impacted. I mean, some of it is really obvious, like grade slipping. There are other kids who really work hard to hold it together when they're at school. It's important to them to do that. Or their OCD kind of symptom profile actually has them excelling academically, which might make some parents very happy, but we also know that these kids are often coming home really exhausted, and it can impact them in different ways and in their families in different ways. There are also kids who have OCD who aren't, they're maybe minimally impacted at school. And so I think including schools, it's a thoughtful process. It might not be the case for everyone that you're working with. So I also want to talk today about, when do you include schools and how do you do that? Yeah, so moving on here, just trying to understand which slides you're seeing. Okay, so I certainly think, just like in my last webinar, that great treatment, including treatment that includes schools, it all starts with really great assessment. And the key, I won't have as many questionnaires and options for you up here as I did in the family webinar, but just very briefly, I still think that the kind of gold star for this assessment is doing a CY box clinical interview. This is such a great opportunity to sit down with kids and hopefully their parents as well, and not just go through a list of obsessions and compulsions and check them off or not check them off. This is your chance to, of course, understand what obsessions are happening, but also where are the obsessional triggers happening? Ask, are they happening at school? What is the feared outcome? And what are the compulsions? Where do those happen? Do they happen at home when you're by yourself? Could they happen at school? When at school? This is when we really put all of these things together. And that will be your first clue around whether you should be including the school team in your treatment or not. We might also want to get a full picture. Maybe there's question marks around whether any academic challenges are related to OCD or not. One option is to just to pull report cards or ask the family in your clinical interview about the academic history. Perhaps this child actually excelled at school And then at age 10, OCD emerged, and we see a kind of slipping of the grades. Those are all really great clues about where your priorities lie. If that is the case, it probably makes sense to be treating OCD to get the grades back up. At other times, there might be a long history of academic challenges that came long before OCD symptoms emerged, and then we'd have a very different angle around those concerns. I also have a specific questionnaire on there for teachers to complete if they're willing, called the Child Obsessive Compulsive Impact Scale. So this is the teacher's perspective on how OCD might be impacting the child at school. And then, of course, we might ask teachers to fill out other forms and get a kind of full picture and context around other emotional and behavioral kind of functioning. You might also want to be assessing further for ADHD or learning concerns, depending on what comes up in your clinical interview with the family. Okay. So I'm going to go through some examples of things you might hear when you're doing the CY box, which is a semi-structured clinical interview. Things that you might see in your office and things to be thinking about that might occur in the school setting because of these symptoms. And we know that OCD looks so different for every child and youth. So this is not an exhaustive list. This is just to get you thinking about what you might see in your office and how that might translate to the child functioning at school. So for example, if I am hearing a child say in the CY box interview that they are getting this not right feeling when they're doing certain things, or they maybe have perfectionistic tendencies. So I'm going to be asking about things like, I wonder if you ever have a hard time, just finding the perfect topic for an assignment when you have a writing assignment. Is it possible that when you're writing, the letters never can look right, or it's hard to get them to feel right? I'd be asking then about, I wonder if you are erasing and rewriting your assignments. I've had kids who have erased so much, they've erased right through their paper. So we want to ask about these things. Similarly, there are kids who will tell you in your interview that they are rereading words, sentences, paragraphs, chapters, so on. We want to understand, is this because you're worried you've missed something or you don't have it quite right, that you just want to be sure you've understood it? This could obviously, all of these things can really impact their ability to start an assignment if they're worried about making mistakes or finding the perfect topic, completing assignments, or maybe they do complete them, but they're never able to hand them in because they're so worried that there's a mistake on that. You might also hear about a child who is repetitively checking things. So I want to ask about, when you're taking a test, I wonder if you have to check all of your answers or make sure they're filled in correctly or perfectly. I had one teenager who got so stuck getting letters right, but also checking his work, that in a really important exam, he didn't get past writing his name. He kept erasing it and rewriting it just to get his name perfectly. He did not do well on the exam. He didn't get past that point. So these are really important things for us to understand. If you're talking about contamination and that's coming up in your interview, then you want to know, where are those obsessional triggers happening? Is school part of that? So are they worried about bringing their backpack home or their school supplies? Can they set them on the kitchen table to do homework? These are important things to know so that we can explain to the teacher why they might not be completing assignments. Okay, other things you might see in your office that translate to things like being really late for school or having really poor attendance. So if I'm talking to a child who has really extensive evening rituals, maybe they are reviewing the day, kind of mentally going through steps, or they have a whole bedtime routine, I want to be thinking, I wonder how late you go to bed if you have to get through all of that. And what does that mean in the morning? Are you able to get out of bed? Can you get to school on time? Similarly, there's lots of kids who have long morning routines. Maybe they're in the shower and they have a number of steps they need to follow, or when brushing their teeth, or they have a hard time making a decision about what to eat for breakfast. Or maybe they are changing their clothes over and over again because their clothes never feel right. Again, I want to be thinking, can you get to school on time if you have to do all that extra work? And do you ever get there? There might be kids who are talking about checking things. Perhaps they're checking that they've got everything in their backpack, or they're checking their locker at school to make sure the lock is right. Again, I want to be thinking about, can you get to class on time? What about those classes right when you've gone to your locker and had to check that lock? Are they able to leave the house? Maybe they're going back and checking that the front door is locked over and over again. Again, what does that mean for school? If I'm talking to a child who has compulsions that involve a lot of time in the bathroom, maybe they are washing their hands excessively, then again, I want to know the context around that. Does it mean having to be excused from the class regularly? Does it mean getting stuck in the bathroom before school starts? How does that impact you at school? Similarly, again, if there's contamination concerns, and I understand that one of the obsessional triggers is a peer. Often there is a peer at school who has vomited or been sick, and they are now a huge source of stress. And so I want to wonder, again, are you able to go to that class where that peer is present? If you have group work with that peer, are you able to get there? What does that mean for you? Okay, other things you might see that translate to just being tired, having a hard time concentrating. Again, if there's those evening rituals, are they getting enough sleep? If I know that there are a number of obsessional triggers that are internal, that are mental kind of triggers, and there are mental compulsions going on, again, maybe reviewing things or praying about things, these are going to be things that the teacher and maybe peers don't even know about, but they are having a really hard time following along with the lesson or knowing what they were supposed to do or just getting their work done. So we want to ask how that impacts them in the school setting. Other things you could see. There are a lot of people with OCD who simply avoid a lot of OCD triggers. If I don't go near that peer, then I'm going to have a much better day. If I just don't bring my homework home, I'm going to have a much more relaxing evening, and I won't get stuck erasing and rewriting or having to find the perfect word to use in a sentence. So if that is happening, I want to know, what does that look like if you are avoiding at school? If you are put into a group with that peer or paired up for work, does that ever translate to some challenging behaviors that maybe don't look like OCD to others who don't know what's going on? Okay, other things. If there are kids who worry a lot about misunderstanding an assignment and having to make sure that they know exactly what they need to do, then does that ever look like reassurance to teachers? I had one teen who was asking 50+ questions in a class. Did I get that right? Is this right? Should I do it on this? It was really disruptive for the whole class, the teacher, the peers. It did not help social relationships. So again, this is going to be more clues. We need to go here. We need to get this sorted out and possibly include the teacher in this work. Similarly, with making mistakes, other kids worry about breaking the rules or cheating. What if I looked at that other kid's paper during the test? What does that mean? Should I confess that to the teacher and just kind of get this over with? If there are a lot of confessions, that's going to be disruptive. It can also, again, hurt these kids socially. So if they have to say, Jane, I think she might have looked at my paper, that's probably not going to go over well with Jane either. Okay, and I think finally, again, just bringing up this fear of contamination, which could be, contamination, fears of germs or illness, but it could also be that this child has transformational or emotional contamination concerns. So maybe there is a peer at school. Let's see, for example, I had a child who was very triggered by another peer, another classmate who was not from Canada. And he worried that if he ever spent time with this student or touched anything that this student touched, that he would be less Canadian. So he spent a lot of time playing hockey and doing things that felt very Canadian. Being paired up with that peer was very distressing, and it could really impact him in the school setting. Okay. So we know that those are things that kids might be doing that we want to know about. We also know, as I talked about in the family webinar, excuse me, that there's often an OCD cycle that pulls in other people. OCD loves to pull in others, whether it's family members or it's teachers or it's peers. And so we want to know directly, how are other people kind of roped in to OCD cycle. So just looking at it quickly again, I looked at this last time, but we know that for OCD cycle, it starts with obsessional triggers. So the child gets a sticky thought, it makes them very uncomfortable, and OCD says, I have a trick for you. Just wash your hands, just confess, just ask if you've got the assignment right. You're going to feel so much better. Maybe it's just for a second or two, but you're going to feel so much better. And they get roped into following that cycle again and again when another obsessional trigger pops up. We know that accommodations, whether they're from families or they're from educators, they play that same role that compulsions do, which is, how do I get that quick temporary relief? And we know that that educators might do things to support the child because it makes them feel more comfortable. So it relieves that anxiety, but it also reduces interference to the school day, to the classroom for that child. So they're done with the best intentions, and they're often very subtle to start. So often the requests that are made of teachers, they're seen as very normative routines. Isn't this a conscientious student that they're asking me if they've got the assignment right? So it makes a whole lot of sense. But of course, OCD usually wants more and more from people. And then eventually it's a bit out of control, it's excessive, and people don't know what to do. So we want to intervene and also make sure that the cycle doesn't keep going, because that makes OCD worse. And the answer is, everyone should learn the strategies for breaking OCD cycle, respond to OCD differently. And really, this is all about building a team to kind of come together and beat OCD. So some examples then of educator accommodations. Again, these are done with the best intentions. They are an effort to support the student, but also possibly the whole classroom, and make sure everyone progresses through the day. Here's some examples that I've come across. For example, I had this really sweet teacher tell me, I think we're good here. All I do is I just wipe everything down in the classroom with these antibacterial wipes. When the student comes in, I just let him know, hey, everything is clean, we're good to go. Very sweet and well-intended, but it also showed the child they couldn't handle being in the classroom without everything being wiped down. So OCD kind of takes the win on that. Other examples I've given: providing reassurance throughout the day, accepting late assignments. If a child is having a hard time writing because nothing looks quite right, or it takes so long, they're erasing and rewriting, then offering a laptop or a scribe makes a whole lot of sense in those situations. Offering passes for safe retreats. So for example, if you're really uncomfortable, you can leave at any time. There's this private space, kind of giving space for rituals and avoidance, done in a supportive way. But when there's no exit strategy or plan to kind of gradually pare those back so that the child looks like anyone else in the class, then we are maintaining that OCD cycle. Okay. So if we know some of these things are going on, then we're going to be thinking, when or should we be including the school team? And of course, this is ultimately up to the family. They need to decide whether or not to consent to school involvement. And I think as therapists, it's part of our job to help them weigh the pros and cons of including educators in treatment. So, we want to help the parents weigh, how much is OCD getting in the way of their child's ability to function at school? How do they expect the school to respond to a disclosure like that? And kind of go through these specific cons if they're there, if the parents are worried about it. So for example, many parents worry about the diagnosis being on the child's file. What does that mean for next year or going into high school or university? We want to give space to be able to talk about that. They might also worry about who is going to know about their child. How is that information discussed around, among school personnel? We also want to address the child's concerns if they have any. Some are really worried that they're going to be embarrassed or singled out. It's going to bring more attention onto their OCD. So we want to also give that space to kids to explore what it might be like and give them some assurances around that so they know what to expect. parents and kids might also worry that others won't understand. So even if they do put OCD out on the table, that others will still see it as, willful behavior or challenging behavior. They're doing these things intentionally or it's in their control. Others worry that even if we do have a plan in place, that there's no guarantee that if you disclose and there is a plan in place that it's going to be followed, that it's going to make a difference. And there are some parents you're going to meet who may not have had the best, most positive interactions with the school, maybe don't have a strong rapport yet. So this feels like a big step. Again, it's something to explore. I think we also, though, want families to know that we can't break that OCD cycle sometimes unless we do directly include teachers and we ask them to try something a bit different. When we do that, there's also a better chance that their child is not going to be misunderstood or mislabeled. So seen as, perhaps lazy or disorganized or defiant, or having issues with attention. And there are a lot of teachers who feel kind of perplexed or frustrated by OCD symptoms. So just knowing what's going on for the child can make a huge, huge difference. We also want to make sure that kids aren't being punished for having OCD. We don't want them to be in detention because they're late every day, knowing that they've been up till 2 a.m. doing an evening routine, or they were so stuck getting out the door that it just actually felt impossible to be on time. And I think ultimately our goal here is to make sure that kids want to be at school and they can feel comfortable there and learn and not miss out on important opportunities for social interactions and learning. So I think that's the ultimate goal, to get a plan in place to better meet their individual needs. Really, teachers can't help if they don't know what's going on. And we might also need to tell parents that a lot of kids actually have IPPs. They would not probably be the only child in the classroom who has one. So these are all things to sort out with the family. So I think, if we do have consent from the family and we decide to go ahead with it, we should initiate a school meeting. And to me, this is a great opportunity, possibly the only opportunity, to really build the treatment team and get information out there that's going to be helpful for the child. So it's our chance to get some general information about OCD, understand if they've seen it before at their school, what they know, dispel any myths, and then also give a bit of information about this child so that, again, the whole school team who's involved really understands why certain things are happening. It's our chance to get some really practical things out there and be really collaborative. So, excuse me. For example, I want to know, I want to give a bit of information, but I want to know, where do we go from here? Today, I wanted to connect with you. I wanted to give you some information, but I think it will absolutely make sense for us to stay connected. So what's the best way to do that? Is there a point person at school? What does communication look like? So everyone knows what to expect. We might establish a reward system. I'll talk about that a bit more later. It's our chance to offer resources. I also have a slide later where there's a great webpage available to you. You could print things off and give them to the teachers. And again, really practical. It's our chance to see what is needed to get things in place. Do they need a diagnostic letter so that an IPP can be created? Would they want to create an IPP in a collaborative way? And how is that being reviewed? So if there is an IPP in place, unlike maybe concerns like ADHD or learning concerns, we might want some general goals for OCD, but we really are hopeful that there's going to be changes week to week. So we need to review that IPP, or there needs to be a more immediate kind of plan in place to make sure that this child is moving forward in their treatment. And we want to consider the timing. Perhaps right before school starts in the fall, that's a good time to have this meeting so that you can connect with the school teacher for that year. And, if you've been working with this child throughout the summer, you could say, this is where they're at in their treatment right now. This is what you can expect going into September. Or maybe it's in the spring when funding meetings are happening and IPPs are being created. Okay, so who to include in this work, including possibly the initial meeting. Teachers, EAs, principals, whoever is involved and is available to support great if there's a school counselor or psychologist who can be involved. They might have more opportunity for one-on-one and immediate support. Have classmates ? Some kids absolutely want their class to know what they are working on, what they're dealing with. And I've had kids who have given whole presentations on OCD. Others want to be way more discreet, and we need to respect that and have a plan in place where that's going to be possible. So just something to consider. So in that meeting, I do go through a bit of information. I have an example here of something I might actually go through and then hand to the school so that, perhaps each teacher has a bit of a cheat sheet for this student, or it can be on the file where it's just a quick resource for others to look at. So for example, we have Tommy. So I'll go through an example here. I want to start by just talking about what I know about this child, their strengths, their talents. So Tommy, he has a great sense of humor. I want teachers to know he's going to respond best when things are kind of kept light and humor is used. He loves math, and he's an athlete. He also happens to have OCD. So it's my chance to maybe introduce that OCD cycle and give some brief psychoeducation, and then talk about, for Tommy, some obsessions he has. He worries a lot about doing the wrong thing. So he worries a lot that he might have cheated on a test, or he might have plagiarized when he was writing that assignment. He also worries about making mistakes. So he's spending a lot of time, even though he loves math, he is checking his math over and over again to the point where he's not able to hand it in, even though he's finished the assignment. He also gets these really intrusive thoughts that his mom has been hurt. So when he's sitting in class, he might all of a sudden be, stuck in these thoughts. And here's some things we see, because we know OCD always has some tricks up its sleeve and says, if you just do this, you're going to feel better. So you might notice that he is confessing a lot of things to you. Maybe he just looked at a paper, or maybe he saw someone else doing something and he needs to tell you. It's our chance to also do a bit of an assessment. Are you noticing that? How often does that happen? I also understand from this family that he asks, the teacher a lot of questions, make sure he's done things correctly. Again, are you seeing that? How often does that happen? Know that when he is looking disinterested in an assignment, or he's not handing things in on time, it's because he's really worried he's made a mistake, or he is so worried about it that he can't get started in the first place. OCD also says, when you're worried that your mom is hurt, just go call her. You're going to feel so much better. So for Tommy, he's learned, if I just go make that phone call, then I can get back to the lesson here. I can listen, I can get my work done. So these are all things that you might notice. And I want to give some tips today about what to do about them. But this is kind of an evolving treatment, and things might be changing along the way. So these are quick tips, but I'm going to be here to support you. We can be talking about this as he moves through treatment. But here's some examples. OCD wants to be able to tell the teacher all these things that have happened. And OCD wants the teacher to respond, it's okay. Like to just acknowledge that they've heard Tommy and his confession. Or similarly, OCD wants the teacher to say, yes, that's right, when he's worried about making a mistake. So things we might try throughout this treatment process are kind of responding to OCD differently. So I'm going to let Tommy know in my office that I've connected with you and that I've suggested that we talk to OCD a bit differently, kind of team up together. So I would ask the teachers, maybe one-on-one, so not in front of all the classmates. You could say to him, I'm here to support you, or maybe gently interrupt when he's confessing and say, remember the plan, we've got this. I'm here to support you, not OCD, that kind of thing. We don't want that to be a surprise. We want Tommy to know that that was coming. If OCD wants unlimited time on assignments, for you to accept late assignments, then we're going to be looking at some time limits around assignments, offering a little bit less and less assurance and reassurance around assignments. And we're going to be doing this in a graduated manner. So again, I can communicate where he's at with that, so you know kind of what parameters to put in place for him at a given time. And again, OCD probably wants unlimited passes to go to the office and call mom. We're going to be setting a baseline around that, and we're going to be reducing that in a graduated manner. So just some quick tips that we can discuss in that meeting. And I might tell them some things to keep in mind. Tommy does not want to draw attention to this. Let's be really discreet. Maybe we need a signal system where he raises his hand if he needs to go to the office, for example. We want to make sure we're not punishing him for not handing an assignment. Let's figure out something that's going to meet him where he's at, keeps interest in math and other things as well. And again, no surprises. So I'm going to let Tommy know that I've connected with you and what to expect. But also, if you know that there's a substitute teacher coming, or some other change, can we let that sub know what Tommy is having to deal with during the day and how to respond, and let Tommy know in advance so that he's ready for it and can plan accordingly. And I think the last part I really want to do in that meeting is make sure they have my contact information and really establish, I want to work with you along the way, and what should that look like? Contact me anytime, even outside of that plan. Okay, so that's the school meeting piece. There's a lot of work though that happens kind of behind the scenes. And so I want you as therapists to be thinking about what the educator's role is and what you're kind of working towards. Excuse me. Okay, so we want educators to really always be driving in one of two gears. We are either having accommodations in place, or we are directly breaking up that OCD cycle and doing interventions. Okay, so I know I spent time in an earlier slide explaining how educator accommodations maintain the OCD cycle. They need to be addressed through treatment, but I do think that there is a time and a place for accommodations. So it's when we're not quite ready to target something, and this means helping the child to stabilize and from falling behind. It's supportive and everyone can make it through the day. In other words, we can't change everything at once. Often these accommodations are already in place before you arrive, and they are good strategies to keep the day going for everyone. So it would be too challenging if we came in and we took all accommodations away at once. So keep some things on the table, and then we're also going to get some interventions in place. This is when we know, okay, we've been working on this in our office, we're ready to take that to the school setting. And this is, going to be the ultimate way that we help the child move towards looking like any other child in the class, and to, of course, overcome OCD. So it's a balance. It's a balance between those accommodations and interventions, and this is going to be an evolving thing. I think I'll come back to some of these points. So just really quickly, some examples of some temporary school accommodations, and then we'll get into interventions. So I have really stressed on there that these are temporary school accommodations. So these are a bit different from the ones that I gave at the beginning, only in that we have an exit strategy. We know that this is where we're at right now, but we are going to be targeting that in a really systematic way. The top three I have on there are just highlighted because they're good examples for Tommy. So he might benefit right now from having extra time on assignments and tests. But then we're going to have a plan to eventually decrease that time so that it's the same kind of parameters as any other student in the class. Maybe having a reduced workload makes sense for Tommy right now so that he, again, can enjoy school and have some success. And then we build up to him doing the same workload as everyone else. Arranged seating might make sense for Tommy. So if he needs to go to the office to call his mom, then perhaps we could set him near the door and he can just discreetly get up and go when he needs to go, knowing that, again, we're going to be setting limits on how many times he can leave. The other ones are pretty self-explanatory. Yeah, I think I will leave it at that. Make sure we get to school interventions. Okay, so I think interventions at school, they should be in line with the overall treatment plan and progress. And it's typically best, I'd say, if it's driven by the therapist. Otherwise, we can have inconsistent messages coming from the therapist and the teacher. There might be too many goals working on, and it can really set treatment progress back. I also think teachers don't want to take on that role most of the time. So I think you should be driving it, but we also want it to be a collaborative process. Set up a meeting with the teacher if you can, incorporate their ideas and their strengths. They know what's going to be practical and possible in the classroom, what the dynamics are in there, so they know what's reasonable and not. Yeah, and then essentially what we're going to be doing is a lot of work behind the scenes in your office, practicing things, getting some traction and momentum. And then when that's in a good place, then we carry those same ERPs into the school setting in some way. It's probably going to look different in the school setting. We need to keep it as simple as possible because teachers are very busy, and we need to appreciate that and keep in mind that it does take a lot of time and effort to do a full ERP, and your student or your client is only one student in the classroom. So we'll talk about some examples here for Tommy to think about what are you doing behind the scenes, and then what are we asking the teacher to do. So here for Tommy, again, he worries about making mistakes. So when he is writing or he's doing his math or he's reading, he is worried that he's made a mistake on his work. So some things we could do in the office. We could have a writing assignment, whether it's from school, something I've asked the teacher for, or something that Tommy brings in because it's his homework, or just something I printed off online. Maybe it's a silly writing assignment that I've created, or I've printed something from the grade 4 curriculum and that's pretty accessible online. So I'd print that off. I might say, okay, we're going to do this. You know, we've got 2 minutes to do it. And I want you to intentionally make a spelling mistake. Okay, so when that time's up, he's going to hand it in to me, and I might give feedback. I might say, oh yeah, I see that spelling mistake here, and kind of comment on it. For Tommy, that might be more difficult than me not giving any feedback at all, but there are some kids who are going to have a much harder time. It's going to be a more effective ERP if I actually don't give any feedback at all. They just kind of sit with that uncertainty about whether I saw it, whether, you know, whatever I thought about it. So let's say we're doing things like that. Then maybe we practice writing a holiday card to team members. So other people who know that Tommy has OCD and have some really intentional mistakes in there. Again, it's practicing handing it in, seeing that person read it in front of him, work up to giving a holiday card to the teacher filled with mistakes. Maybe then working with the teacher to think about, you know, Tommy's going to be writing this silly assignment or something he's doing with me. It's got mistakes in it. He's handing it in to you. Maybe you can prepare the teacher on how to respond. That's going to look different for each child. The ultimate goal is working with the teacher to hand in some real assignments with mistakes, and then eventually not including the teacher and just giving something to the teacher and not knowing how they're going to respond and how they're going to grade that. So it's usually good to keep the teacher involved in this process so that, again, there's no surprises and everyone knows how to respond and what to expect. Okay, another example. Tommy, again, he gets these intrusive thoughts that his mom has been hurt. So in your office, there's lots of work we can do. Maybe you're sitting in your office and mom's in there and you're saying out loud, mom might be hurt. So it's just about kind of getting those words out, bringing that intrusive thought on intentionally, but knowing that mom is right there. Then maybe we have mom in the waiting room once that gets easy and say the same thing. Mom might be hurt, but we can't see her and get that immediate feedback. Maybe then you can go to the school setting. Maybe you can go to the school, or maybe you can even zoom in and make sure that the child is set up in a private space at school where, again, you practice doing exactly what you did in your office, but you're changing that context and location. Saying out loud, mom might be hurt. So you're there. Maybe then we include the teacher. You know, at some point, I wonder if you could take 5 minutes with Tommy in this private space and just practicing, mom might be hurt. So again, bringing that intrusive thought on your own terms, not on OCD's terms. When we know it is popping up at school. Excuse me. So maybe doing that with the teacher, and then maybe the ultimate goal is, you know, can Tommy have a private space where he can just go and he can practice bringing that intrusive thought on purpose. Of course, the other side of ERPs is also having a response prevention plan. That's the exposure part. The response prevention plan would be decreasing the number of calls that Tommy makes to his mom during the day, doing this in a graduated manner. So again, maybe we're working with the teacher to just understand how many passes are happening in a day, how many times does he call? Okay, let's set that as the baseline, and then let's make a plan to gradually decrease that. Maybe Tommy has to hand in a pass every time, and he's given 5 at the beginning of the day, and then we reduce that to 4 and 3 and 2 and 1. So more work behind the scenes, and then maybe one or two things that we're asking the teacher to do as we go along. Okay, I won't talk about this too much, but like I said, we really want to make sure that teachers and others involved at school, they understand why a child is doing something, how their OCD is impacting them at school, and then make sure that they're not being punished for having OCD. You know, if they're late, if they're not handing things in, can we work something else out where we can meet them where they're at, we can set them up for success, and then reward them for doing brave things and for challenging their OCD. With school, I think it is absolutely critical to make sure that this reward plan is very, very simple. I might be asking the teachers if they already have a reward system in place that we can kind of map onto. I have that example. I think I had this in the family one as well, but I had a child working towards sparkly slime. That was her reward, because why wouldn't you? It looks amazing. And we can just create a puzzle piece, and we could give all those puzzle pieces to teachers. You know, every time she challenges OCD in this way, you have that one goal maybe that you're asking the teacher to kind of monitor or be a part of. Every time they do it, she gets a puzzle piece. She takes them home. When the puzzle pieces all come together, then she gets to go and buy her sparkly slime. So work with the teacher to find out what's going to be reasonable. Understand from the child, you know, how discreet does it need to be? Can it be a quick tally? And how does everyone communicate about that so that everyone knows what to expect? Is the teacher comfortable with a quick email to parents each day or at the end of the week or every other week? I had a mom who created a whole chart about what her child was working on at school and gave it to the teacher each week, and she just checked off, you know, how it went so that she could put that in the backpack, and mom knew what was happening so she could reward it home, and then they could bring it to my office and we could talk about how things are going and how to tweak the plan. So another important conversation to have. Excuse me. And I think so schools are going to be involved in different ways in your treatment for different kids, but I think it always makes sense to, you know, when you're getting towards the end of treatment, to just call the school again, whoever that point of contact is, thank them for their time and their efforts and their support, and explain that treatment is ending, so they shouldn't be expecting calls from you anymore. And then also to just put on their radar. I don't want teachers to be hyper vigilant to these things, but to have an extra set of eyes in the classroom where, again, kids are spending so much of their time, to just look for some signs that OCD might be trying to creep back in, because we know OCD waxes and wanes. So can they communicate with the family if they're seeing any of these things? They're starting to fall behind again, really tired, they're often late, or you might actually see some rituals happening in the classroom. Maybe they are asking to go and wash their hands frequently, or they are erasing and rewriting. These are all important things for the family to know, who can then contact you to let you know, I think we need a booster session. Okay, and then as promised, I have a great resource up there from the International OCD Foundation called Anxiety in the Classroom. So there's a whole link to that on their website, but it's also anxietyintheclassroom.org. Lots of great resources on there that you can also provide teachers. So I will leave it at that and take some questions.
Wonderful. Thank you, Dr. Bliss. Yes, so attendees, if you would like to pose questions in chat, that would be great. Simultaneously, I'm going to just launch the final poll, or sorry, webinar evaluation, and please do complete that over the next 10 minutes or so while Dr. Bliss is answering hopefully questions that you have.
Yeah, I think questions are great and welcomed, and I'm sure there's lots of therapists who also work with schools all the time. So even if you want to post a great tip for everyone, happy to read that out or discuss what you do. hopefully this means that this is a pretty straightforward topic and everyone feels really confident working with schools and kind of knows how OCD pops up in the school setting.
Okay, so there are no questions as of yet. If you do, well, we do have about 10 minutes or so, and I can see you're still completing the post-webinar evaluation. Please, if you do have a question, do post it in the next few minutes.
Maybe I can ask you, Julian, was I correct in that there is another webinar for teachers specifically that talks about strategies for them in the classroom?
Indeed, there was one.
There was one.
Earlier this week or beginning of last week. No, last week. Which yeah, the recording of it is available on the website. So anyone who wishes to access that can just go to the Educators drop-down menu, go to video recordings, and can view it. But it certainly does dovetail with what you presented today.
Great. If I had known I had more time, I always have more to say.
Just checking that the chat function is working. It is. I did receive a private message, so there we go.
So yes, I did talk about, thank you, Rhonda. I did talk about assessment tools, and let's see, can I go back to that? It's gonna take me a few minutes. Who put all these animations in here? Oh, I missed it. Yeah, so I was saying that I think that going through the CY box clinical interview, semi-structured interview, is the best tool for a lot of reasons, but even for including schools, this is your chance to really understand what the symptoms look like for this child. So I'm going to be asking about not just what the obsessions and compulsions are, but where are the obsessional triggers for that? Is it happening in the school setting? Does it happen in certain classes or certain times of day? And then in terms of compulsions, asking, how does this impact you when you're doing homework? How does this impact you to get to school on time? I wonder if you're worried about that. Does that happen in the classroom, and what does that mean for you? So it's your chance to really get a full picture. I would absolutely take your time going through that to really understand it, really picture it for yourself, because it really sets things up for treatment to go smoothly and to make sure that you have all the key team players, including the school. And then I was also just saying, we always want to put things in context. So maybe you're doing other questionnaires with parents or with teachers to understand other emotional behavioral concerns or learning concerns. There's a specific scale on there that we can ask teachers to fill out, the Child Obsessive Compulsive Impact Scale. Even some of the scales I had up in November for family to report on includes impact scales that would include some questions about how they're impacted in getting to school on time and doing homework and all sorts of things. So those ones would still apply. You might look at report cards to see how they're impacted academically. Of course, if there's been a psychoeducational assessment, you can review that as well. So hopefully that answers your questions.